Our next speaker is Dr. Natalie Newman. She's no stranger to most of us, I think. She's a board-certified emergency physician who's been practicing for 25 years. She's also a former Army physician who currently works as a traveling MD.
Thank you. Thank you, Dr. Cavalli, and good afternoon, everyone. As some of you may know, approximately 22 states and DC have unsupervised practice in their states. It is important to note that since the unsupervised practice of nurse practitioners in those states, not one regulatory body has followed up to determine if the care touted is what nurse practitioners claimed it would be. How do we know the care being provided is of top quality? We don't. But this is what Jim Wood alludes to, that as a fact that the proof of that care is sufficient. We have red flags in California that are telling us that this is not a good idea to move this bill forward. The California Nurses Association and the Nurses Service Organization, a nursing liability insurance company who insures over 26,000 nurse practitioners in the state of California, published a nurse practitioner claims report in 2017. In summary, since 2011, practice payouts have increased. Diagnosis, medication, and treatment care management allegations accounted for 84.5% of all the closed claims during the period of 2012 to 2016. Additionally, another study by the Controlled Risk Insurance Company, a malpractice insurance company as well, was published in October of 2019. It encompassed a 10-year period, included the entire United States between 2008 and 2018. The conclusion: although nurse practitioners as a whole have minimal impact on overall practice exposure, 59% of those cases involved high severity events across all hospital settings. High severity meaning those cases that resulted in death or permanent injury. Of those high severity cases, 79% involved patients in the hospital. Similar to the aforementioned study, the majority of cases involved error and diagnosis. I suspect that neither of these two studies have been reviewed by the legislators in this state who are considering passing this bill. Had they been, it should have raised concern about the push for the unsupervised practice of nurse practitioners. Here's the bottom line. If their intent is to enable the practice of medicine without a medical license, then legislators have not done their due diligence in ferreting out malpractice data on nurse practitioners, which would provide some indication on the safety and competency of their practices on the citizens of this state. It begs the question, what can California residents expect when all safety measures of supervision, which are designed to protect the public, are removed? Additionally, appropriate oversight by the California Board of Nursing cannot be guaranteed in light of the recent audit, which revealed that the Board of Nursing executives falsified data related to complaints regarding nurses and nurse practitioners. Thank you for your time.